Next, we are going to talk about the bites. So before we proceed, there is a lot of natural toxin poisoning that can be found in our country. From 2006 until 2014, there is a lot of study that has studied about the toxin available in our country. So the highest case has been recorded is from the snake toxin, which recorded about 418 cases compared to the rest of the toxin. So today we are going to talk more on the snake envenomation. So what is the snake envenomation? Envenomation is defined as a potentially life-threatening disease that typically results from the injection of a mixture of different toxins, which is in this case is the venom, following the bite of a venomous snake. So we should know that not all snakes are venomous. Only about 40 species of snake are venomous in Malaysia, which consists of 18 land snakes and also 22 sea snakes. And bear in mind that all sea snakes in Malaysia are poisonous. So for more than 50% of the case, the species of the snake cannot be identified. But if it is identified, most likely is identified as viper. And why the snake envenomation is a concern in the medical emergency? This is because the bites by venomous snake can cause local effect and also systemic effect that can lead to the life-threatening medical emergency. Venomous snake in Malaysia could be divided into three big groups, which is the first one is the Elapidae, which consists of the cobra, king cobra, kraits, and coral snakes. And Viperidae, under this category, they have viper, ulat kapak. So the common species of the Viperidae is the Malayan pit viper, which is high and can be found in the region such as Kedah, Perlis, and Perak. And personally, I think it's maybe due to the agricultural factor because there is a lot of bendang and sawah. And last one is the Hydropidae sea snake, ular laut. Alright, so for common sea krait, is one of the species fall under category of Hydropidae. So typically, if a patient complain of painless bite during swimming in the ocean or sea or any water activity in the ocean, but initially it start with a painless bite and also develop symptom afterward, suspect that the patient have the sea snake bite. So the first we need to know where the difference between the venomous and the non-venomous snake. So venomous snake usually they have a more sinister look compared to the non-venomous snake. This can be seen by the elliptical vertical pupils and also triangular shaped head. Meanwhile, for the non-venomous snake, usually they have the round pupils with the head more continuous with the body. However, despite of those knowing those two differences, there is issue in identification of the snake in Malaysia because there is no simple rule to identify venomous snake. And also, for the venomous and non-venomous snake, sometimes they have almost same morphology. And also when the patient come with a snake bite and they describe the species without bring the snake to the ED or at least take this picture of the ED, they describe with using with the local names. Sometimes this description can be inaccurate and misleading, which lead to the misinterpretation of the data and lead to the wrong treatment could be given. And last one is the care should be taken when examining the snake, and attempts to capture it is strongly discouraged because this may place others at serious risk of envenomation. And why it's important to know the medically important snake in Malaysia is because we want to know what kind of snake that we are dealing. If we don't know the exact species, at least we know what kind of big group this snake we are dealing with. For example, like whether it's Elapidae, Viperidae, or Hydropidae, and how a patient could help the doctor to achieve these objectives if by proper identification of the snake. They can kill or restrain the snake and brought to the hospital. And the least they could do is snap the picture of the snake and show it to the physician that attend the patient. So these are a few examples of the medically important snake in Malaysia. So the history taking of snake envenomation. So the first we need to know the date and time of bite. So why is that? Precise time of incident to monitor the progression of the sign and symptom. Because once the patient got bite from the snake, they will start to develop a course of action. So by knowing the date and time, we can anticipate the clinical course when by the time they came to ED to seek for the treatment. Next, we need to know the geolocation of the incident. By knowing the location of the incident that occur, it might give the emergency physician that attend the patient the rough idea on what kind of species of the snake they are dealing with. For example, like ular tedung, cobra, sometimes they can be found in the swamp or farm or open field. Like ulat kapar, they can be found in the garden, the village, and also the forest. So basically, by stating the location of the incident may give us a raw idea. And also, next is the detailed event of the bite. We need to know what the patient is doing before the bite. Was the snake situated on the ground, floor, or on the tree? Any particular behavior of the snake, and this is most likely to identify the species of the snake. Number of bites, strike, and duration of the bite, so that we can treat the lesions. And what happened to the snake, whether it's escaped, captured, or killed. And also, we can ask the patient if they have any picture of the snake. And next one is the parts of body bitten. Bite at the hand may indicate the patient was bitten while trying to hold the snake. And also we can see and observe if there is any swelling due to the bite. And also what was done to the bitten limb area. Why we ask this? Because some of the patient they still have their traditional approach on the snake bite. Sometimes the traditional approach prove harmful and also useless to treat the snake bite. And also we need to ask whether is there any treatment has been given at the primary health facility. And also the last one is we want to assess the anaphylaxis risk. So we need to determine allergies and any history of snake bite or antivenom administration before, and also if there is any history of anaphylaxis. And also we like to ask about history of exposure to the snake before, whether they are snake handler or they are snake catchers. So this is the first aid. So the first we need to assure the victim who may be very anxious. Next we want to immobilize the bitten limb with a splint or sling. Why is that? We want to slow down the progression of the toxin within the blood circulation. Next one is to consider pressure immobilization for some electric bites, because electric bites are known as a neurotoxicity snake, so they can cause the toxin to spread faster in the circulation. And also last one is to avoid any interference with the bite wound. The bite wound from the snake is open wound, so we afraid if there is any infection, so we want to minimize any interference near to the region of the bite wound. And the traditional approach, which is found to be useless or even dangerous, is tying tight bands, attempt to suck out the venom out of the wound, topical application of chemicals, herbs, or ice pack at the site of the bite, and making local incision. And this is the clinical feature of the snake envenomation. Generally, it could be divided into local and also systemic effect. For the local sign and symptom, patient can present with the fan marks, local bleeding and bruising, lymph node enlargement, lymphadenitis, inflammation, blistering, local infection, abscess formation, and also necrosis. For the systemic sign and symptom, generally they can present with nausea, vomiting, malaise, abdominal pain, weakness, and drowsiness. And some species of the snake, for example like Viperidae, they can have cardiovascular effect, which is evidenced by dizziness, faintness, collapse, shock, hypertension, cardiac arrhythmia, and also pulmonary edema. And for the last three systemic signs, which is the hematotoxicity, neurotoxicity, and myotoxicity, I would say this more likely specific to a certain species. For example, like hemotoxicity, it can be seen in a snake bite from the Viperidae species. For example, like Malayan pit viper snake bite. So the patient can present with a traumatic bleeding, systemic hemorrhage, coagulopathy, and also thrombocythemia. And you can see in the first and second picture, it clearly shows that there is a coagulopathy issues that arise. So we should suspect higher suspicion in Viperidae snake bite. Next one is the neurotoxicity. This can be present in the Elapidae and Hydropidae. So neurotoxicity, the patient can present with a flaccid paralysis, respiratory failure, which require urgent airway emergency management, heavy eyelid, ptosis, and also difficulty in swallowing. Meanwhile, for the myotoxicity, usually they can present with a rhabdomyolysis, which is a part of the muscle injury. They can present with a generalized muscle pain, muscle weakness, and also myoglobinuria. And the third picture, you can see there is a ptosis and also drowsiness. So main likely they have the neurotoxicity effect in this case. And this is a summary what I mentioned just now. For the Elapidae and Viperidae, they share the same local effect, and for the systemic effect they have different, which is neurotoxicity for Elapidae and hemotoxicity for Viperidae. Sometimes the patient victim from the Viperidae bites, they can shock and also cardiac arrhythmia. And for the Hydropidae, typically the patient will complain of having painless at bedside initially and without any edema, but through the time they will develop myotoxicity effect and also the neurotoxicity effect, and worse they can develop cardiac arrest and also acute renal failure due to rhabdomyolysis, which is a part of the myotoxicity effect. So for the physical examination of the snake envenomation, we should resusc. Next we should do the general examination, which is a part of the routine when it comes to ED. And also I would like to highlight on the bite site examination. We want to look for the puncture wound, fan teeth mark, although they are not always evident, but also may not present with the identifiable tooth marks. We want to check any inflammation sign, which is the swelling, bruising, which is the early sign of the necrosis, and also any blistering effect. We also would like to initiate the rate of proximal progression measurement. And also, if possible, we can take the serial good quality pictures to monitor the progress. And the last one is the specific sign. Why specific sign is important is because we want to appreciate and also put high suspicions on what kind of snake that we are dealing with, especially the species of Viperidae and also Elapidae. And this is the example on how the swelling progress proximal are being recorded. So this is a part of the rate of proximal progression that we do. And to make it easier, usually we do the grade of envenomation. So how we do is thoroughly examine the patient for the local, general, and also systemic environment sign. So this is the summary, and you guys can refer later. And this is example of the demonecrosis. For the investigation, there are a lot of investigation could be done, which is one of it is the coagulation profile, full blood count, renal function test, and liver function test, urinalysis, creatine kinase, ECG, and also arterial blood gases. So for the treatment for the snake envenomation, we have general measure and also specific measure. For general measure, we should give adequate reaction for the patient so that they become less anxious about the snake bite. Next, we can do the ABCDE approach, which is A, airway, B, breathing difficulty, C, circulation. We have to assess if there is any shock or bleeding issues. Next is disability. Because from the snake bite, patient may experience disability afterward. For example, like for the Elapidae species snake bite, they can develop the neurotoxicity effect. So afterward, neurotoxicity effect can develop into respiratory failure, which is also a part of the disability. So what we do is that we will maintain the airway by start with the rapid sequence intubation. And the last one is the environment. So we need to ensure that the environment is safe for the patient. And next, we can treat the local lesion accordingly and also treat shock according to the protocol. And tetanus prophylaxis is found to be helpful to combat tetanus toxin as well. And also, patient may also be progress and proceed to the admission for observation at least 24 hours. And for the specific measure, we discuss on the antivenom, analgesia, anticholinesterase, and also antibiotics. For antivenom is a special immunoglobulin that have been developed to counterattack the characteristic of the venom itself. So we have two available in Malaysia. So the first one is the monovalent antivenom, and the second one is the polyvalent antivenom. For the monovalent antivenom, we have king cobra, cobra, banded crate, Malayan pit viper, and green pit viper, which is according to the most common species of the snake that can be found in Malaysia. And the next one is the polyvalent antivenom. Polyvalent antivenom is administered when the snake species cannot be identified. So how is it cover on the broad of species of the snake which have hematotoxicity effect and also neurotoxicity effect. And this is the indication for the antivenom. It is recommended if a patient start to develop local envenoming and also the systemic envenoming. Analgesia is given to treat the pain and agitation. We can administer ibuprofen or diazepam or both. For anticholinesterase, it's be found to be useful in patients with a neurotoxic environment, especially those bitten by cobra but not crates. And for antibiotics, it's considered in snakebite with the local tissue necrosis, dermonecrosis, or extensive tissue injury to prevent the infection by aerobic and also anaerobic organism. And this is the flowchart management for snake envenomation in hospital. If we are ever in doubt, please get the consultation from the specialist in charge or anyone who has a higher experience or expert in this field. Next, we talk about the sting. So, in this slide, I will focus more on the Hymenoptera sting, which is fall under category for bees and wasp family. So, for the bees, the stinging only when provoked. A female bee is capable of stinging once only. So, what does it mean? That the sting will stick on the skin after they sting the human, and male bees have no stinger. Compared to the wasps, only the female have the stinger on the posterior aspect of the abdomen, and they can withdraw the stinger and can do the multiple sting on the human. Usually we can find their nest in the ground, in trees or in walls. So that's why we have to avoid doing any activity near to this place if there is evidence of nests for the wasp. Usually the patient will present with a pain like erythema, edema and pruritus at the sting site. Meanwhile, for the local reaction, they might develop urticaria, which is a part of the rash, reddening rash with a swollen area at the sting area. And for the steam reaction, some of them will develop toxic reaction, anaphylactic reaction, deal reaction, and unusual reaction. For toxin reaction, a systemic toxin reaction from venom, usually patient can present with nausea, vomiting, diarrhea, lightheadedness, and also syncope. But some patients may present with a headache, fever, drowsiness, involuntary muscle spasm, edema with urticaria, and sometimes can present with a convulsion. Renal and hepatic failure and also disseminated intravascular coagulation (DIVC) can result from massive bee stings. Therefore, it is very concern for us if the patient have massive bee sting or not, so that we can anticipate the clinical cause. And elevated creatine kinase is due to the rhabdomyolysis. Next one is the anaphylactic reaction, which is one of the common cause. A generalized systemic allergen or anaphylactic reaction. It can be a single sting or multiple sting, and it may range from mild to fatal, and death can occur within minutes. So it's urgency. So the majority of the such reaction develop within the first 15 minutes, and nearly all occur within 6 hours. And the symptom can be urticaria, wheezing, cyanosis, nausea and vomiting, bowel and bladder symptom, syncope and facial flush. Sign and symptom may recur 8 to 12 hours after the initial reaction. Some patients also can develop delay reaction, and usually they can appear 5 to 2 weeks after a bite of sting. And the patient can present with a symptom and sign of fever, malaise, headache, urticaria, lymphadenopathy, and also polyarthritis. And it can be due to the immune complex mediated. And last one is quite rare, is unusual reaction. It can occur with the sign of encephalopathy, neuritis, vasculitis, and also necrosis. And this is the algorithm of the treatment of Hymenoptera sting. Usually, first one we remove the sting by scraping the sting out. Occasionally, some people use the credit card to scrap the sting, but if possible, if you are doubt, you can refer to the emergency department. And also, we wash the sting site with the soap and water. We also apply aspect to reduce the inflammation, and oral antihistamine and analgesic also been given to as a pain